Okay, so next is Dr. Chanprasert. You want to come up? Thank you. Thank you, Dr. Saeed. Again, we're just holding questions to the clinician panel after Dr. Chanprasert.
So how can I navigate my slide? Oh, okay. So my name is Sirisak Chanprasert. I'm an adult geneticist at University of Washington School of Medicine in Seattle. So I picked up from Dr. Said about like a transitioning care from children to adult for patients with PURA syndrome. So I have taken care of like a pure perfect Taylor and her family for many years now. And even though Taylor is the first patient that I have seen with the Pura, but I have learned a lot, and I have learned with the family, like I try to navigating care from childhood into adulthood. And trust me, like many parents, like it's not just only like a Pura syndrome I have seen, or like genetic diseases that transitioning from the children hospital to adult hospital, and they just say that it's like a culture shock, like stepping from like a lavender field to the apocalyptic world. So it's a different, like an entire, like a different, like a territory. So my role, because I am adult trained, so I see lots of adult patients, and I train in clinical genetics as well as metabolic diseases. So during the time that I trained in Houston, in Texas, I saw lots of like children patients. And then my interest is to try transitioning care so that they have a smooth transition. And I have to say that for the adult physician, they just set a boundary, a very clear boundary. So this is children, this is adult. And then once you are children, you are children. And once you step out of the children world, you are adult, and the children won't take back. So it's just kind of like a very clear boundary, but I don't see it that way. It's more like a gray zone, like a sponge that you can go back and forth. But I would say that my colleagues in adult medicine now is understanding more, because our patients live longer due to like a medical science. And at some point in their career, they will need to see this patient. They cannot just avoid it. So I think that it's a very important for us as adult physician to know about it. So it's a rare disease, yes, but again, we are doctor, we cannot just say, oh, I just want to see only common disease. So it's not like that. Okay. Oops. Can I next slide, can you help me? Okay. So what kind of evidence that I have? Obviously, so I have been taking care of Taylor. I learned from her, and the parents are the best advocate, and they know more than me because they have lived with their children for like since they were born. So every time that they just say something, I just take it seriously. And what I look into the literature, like a PubMed, and try to find out like how many adult patients or like any cohort that I can glean from. And the last thing is I just extrapolating from other patients that I have taken care of. So all of these are not a very well study, but it's more like anecdote or like an experience that I will share with you. Next slide, please. Okay, so there are at least three things when I see in my clinic. So with the patient with like disease that present from birth to adult life, if they have the new symptoms, what I ask myself is whether these symptoms are related to their underlying disease. Like, is this related to PURA syndrome? And if not, what it is? And once we find out what it is, can we use the same treatment as people without this condition with the patient with PURA syndrome? So this is a kind of framework that I try to answer every time I see a new thing coming up. Okay. And next slide, please. And we know for sure that there's a lots of clinical features of patients with PURA syndrome, and we still have yet to learn about the full spectrum of patients with this genetic condition, especially in adulthood. We don't have much of information, like once they grow into adult, like what kind of symptoms or the complication of something that has been happening for a long time since their childhood period. So what I typically see in this situation is more like a neuromuscular problem, because majority of neurogenetic or neurometabolic disease, like a PURA included, you can have like a hypertonia of the trunk or hypertonia or hypotonia of your limbs, and that can cause like a scoliosis because you don't have enough power to just like try to constant your spine. And that scoliosis is quite common, as well as like a contracture, especially in the ankle and in the hands or in the upper limbs. And that are very detrimental, because many patients with neurometabolic or neurodevelopmental problems, they are not very well active. So if they develop this kind of problem, they just like limit themselves of doing anything, and that make things worse. So that's why I have to make sure that this has been addressed by talking with like an orthopedic surgeon, or like the surgeon that listen to about this problem and navigate the problem with them. I don't see myself as the specialist or like an expert in this. I see myself as a liaison, like I try to get everyone together, because obviously this is a rare disease, and I've learned as I've seen patient, but at least I know and confident enough to say, hey, this is something and I need your help, and could you help us? And there's a difficulty because, like I said, adult, like I had a patient that not children anymore, but she's like a look like a children, and because she's small, she's short stature, and then she had like a hip fracture, and the adult orthopedic doesn't want to operate on because she's so small, but the children hospital cannot do operate on her because she's adult. It's just like back and forth, and finally I try to like help navigate that, and just to make sure that the patient get everything they want. Or even like a seizure disorder, we know that PURA syndrome can have like a the seizure problem, and then again, I just try to talk to the pediatric neurologist and adult neurologist, or everyone that are involved in the care, and try to come up with the plan or something that can help the patient. Next slide, please. Yes. Yeah. And then when I researched this, I saw that many patients with PURA syndrome, when they grow up, they can have like a refractive errors, which is like a nearsighted or farsighted. This is easily corrected. And then the hip dysplasia, because not many patients like moved, and they can have like a pain. And again, it's difficulty like to let the caretakers know that, oh, I have pain, and as well as like a gastrointestinal problem, like a swallowing difficulty, like a increased salivation and constipation. So it's just like a lots of thing that we should look for, and a lots of coordination among colleagues in adult physician world. And not only that, I think that we have to build like a relationship with the pediatrician that have been taking care of this kind of patient, and then we need to have a frank conversation of what need to be done. When you see this, can I talk to you? Like if patients have something, or you can talk to your adult colleague and just let us know what I can help with the patient. So it's just like a take so much effort for this transitioning care of the patients. Next slide, please. And yeah, there is no like a explicit transition a plan or process. So everyone works in their silo. So this is a pediatric neurologist, this is a epilepsy, so epilepsy don't see headache. So it's just like they have their own like a specialty, and everyone is so busy. It's very difficult for everyone to do even Zoom meeting, like to get together and then just manage the care plan, or like try to help the smooth transition. I don't want to make you worried that much. I think that right now adult hospital try to be more like a responsible for the transitioning care. It is now much better than it was, but there's still like a room for the improvement. I think that we need to have at least a doctor, like a primary care provider, or anyone that step up and want to just like to be a liaison, a coordinator that coordinate everyone together and make like a primary responsible for the patient during the transition. And like I said, like a fragmentation in adult service. And I have to say that it is better than the pediatric hospital to care this kind of like a neurodevelopmental problem. So everyone loves children, and once you go into adult, oh, who cares? It's just like this mentality that I have been witnessing or experiencing for a long time, and there is a lack of understanding. Yes, this is a rare disease, and majority of adult patient, adult physicians, they don't want to care for rare diseases. They just want to do everything according to their guideline, and only like a small proportion of like a physician, especially geneticists, that uh, uh, very interested to see like this kind of like a rare diseases, and very difficult to access like a neurodevelopmental service in adult world. This is just like there is a lot of barriers that you need to go through, and the f- the frenemy is insurance. Like I said, like they love children. They you can do lots of things for the children, but once they are adult, they just like put up a high wall, and we have to do like a multiple appeal or to get the service the patient needs, and they just say, oh, they are already adult, they don't have intellectual disability, this is a diagnosis of children, why do you need to do this kind of test, why do you need to do this kind of care, or even like some nutrition that the baby has been on for a long time, but once they are adult, so this is not the nutrition for adult anymore, and the insurance doesn't want to pay. So it's just a lots of issue that can happen. And next, please. So I think to solve this problem is the early discussion. So once I I know that every child, like every person with a PURA syndrome has different clinical presentation. But now, because the advancement in science, they are growing, and they're living better than other peoples in the past. And at some point, I think that around there is no set age group that you need to talk with your pediatrician and say, hey, we are going to transition my child to an adult hospital. I think that we should do it now, like a better safe than sorry, because it's just a long process. And then you just ask around, is there any adult doctor in the area, or like a clinical geneticist that usually goes to, or like a adult neurologist that specialize in like a difficult to care, like a epilepsy. And then just like a make contact, I would say like a call, or like talk to them like a by phone, or like make a Zoom call, so that we have like a plan, and it has to be done like in advance, so that everything can be very smooth. And some institution has like a transitional care program, like University of Washington. We have like a transitional care that there is a pediatrician and also like a internist, or sometimes you can have like a double board, like a pediatrician and internist that see this patient and try to transition from children into adult, and just like list all the patient need during the adult life, and then just try to navigate like a social worker, like a physical therapy, occupational therapy, like they try to do as much as possible for us to make a transition like a happening. And I think that the finding provider who is willing to be the lead in your child care, and it could be a primary care doctor and or like a geneticist, and no one has to be like a specialized in this, or no one has to be like an expert in this, because you parents are the expert, and then you can tell the doctors, hey, I think what you should do this, we should do that. It's just like working together. And the primary provider is more like a try to get people together, like make everything cohesive so that we can learn from everyone. And it's just more like a multidisciplinary care so that your child has a very productive or like a better life. And yeah, and the last thing I think, like, share the records to the all specialists involved. I think that is a very important, and it's not difficult now in the age of like a Epic or like electronic medical records, that we see a lot of like assessment and plan. But like I said, majority of them would just look at their problem and say, oh, you have seizures, and then blah blah blah, and then the other people say, oh, you have like a kidney stone, if they blah blah blah. So I think that it just that I always emphasize, it's more like a try to coordinate with one another, and with someone that has to be lead the clinical care. Next slide, please. And you can have like lots of complications. So not just only like an underlying disease that present with something, but when you're getting older, the life is more complex and you can develop something else. I always tell like my colleague, like a primary care provider, that don't assume that everything is related to PURA. So she can have many things as she wants. So she can have like a diabetes, or like she's not like exposed to sun, and then she can have like a vitamin D deficiency, or like we find now that people with like intellectual problem has more incidence of developing like a kidney stones than others. So we still don't know why. It could be just correlation, but it's not causation. But some studies suggest that it might be due to like a not drinking enough like a water, or like a change in nutritional status, especially in people that get like a tube fed, and that can create a problem with like a kidney stone. So not only like a taking care of the symptoms that specific for the PURA, but also expect something else, like something that we find lots in adult patients, diabetes, high blood pressure. And I always ask myself if I need to give like a tailored medication, should I, this medication would be safe or not? Is it making worse, or should I try to be very cautious, or like find out the alternative? So there's a lots of things that have to think through. But in my experience, so majority of disease that found in adults, the treatment is not going to be very vary, like not different between the people with underlying and the people with no underlying diseases. Okay, next slide, please. Yeah, and again, so I just raise this issue, like a kidney stone. It's not just only people with PURA, but all the genetic conditions that I have seen, especially like an intellectual problem, they tend to have more prevalence or incidence of the kidney stones. Next, please. Yeah. And I always say to the team, the multidisciplinary team, we have to aware for the aware of the common condition in adults. So, like I said, the life is complex. You can have everything, and need to differentiate symptoms from PURA symptoms. Like I said, not everything has to be explained by like a PURA symptoms. And I always get a call like not just only PURA, but also like a chronic disease, like a patient got a hiccup. Could it be related to this or that disease? I just say I don't know, but maybe we can find out together. We can search a PubMed and try to find out. So it's just more like a cordially like a talk to them and try to establish care and establish trust between other and make sure that we learn together. And yeah, it's a treatment of conditions developing during adulthood and childhood. So there is a nuance amongst it. And just to make sure that whatever you give to the patient is not dangerous. So just to at least like a check by the literature, PubMed, or any the internet that you can. And next, please. Yeah, I think patients, like children, will go into adulthood, and I don't doubt that we will find the treatment for the patients with Pura syndrome. But I think my job, or like some a clinician, is try to make sure that we comfort our patient always, because we might not cure always, but we have to comfort them. And the transitioning care is one of the things that is very important, but underappreciated. And I hope that in the future, many adult physicians would be able to engage and help your children when they are becoming adults. Okay, thank you so much.